Welcome everyone to this forum seminar. For those that don't know me, I'm Dr. Gemma Sharp from the University of Exeter, and I run the 4M Consortium, with the M standing for menarche, menstruation, menopause, and mental health. And today we're really excited to be joined by Dr. Julie Hennegan, who is a senior research fellow at the Burnett Institute, where she co-leads the Global Adolescent Health Working Group. And Julie is a mixed methods researcher investigating the social determinants of health and the evaluation of complex social interventions. And her work focuses on menstrual health across high, middle, and low income country settings. So Julie will be discussing today the Adolescent Menstrual Experiences and Health Cohort, or the AMEHC, and that's the cohort that she's established in Bangladesh. So I will pass over to Julie and make sure that you can speak. That's good.
Perfect. that will help. Great. I'll just share my screen. Hopefully you can see that now. Thanks so much for having me, and it's so lovely to be connected to this group and forum. Oh, sorry, I'm getting other messages. I'm Julie. As Gemma mentioned, I'm coming to you from the Burnett Institute in Australia, in Melbourne, where it's 8 p.m. in the evening. So you're getting the last of my brainwaves for the day, but hopefully coherent enough. It's really nice to be joining you and sharing about this study that we've spent the last 2 years setting up in Bangladesh to really look at understanding the impact that menstrual health has on girls' lives. This work is really a collaboration between our team at the Burnett Institute, the James P. Grant School of Public Health at BRAC University in Bangladesh, WaterAid Bangladesh, and their partner in Khulna district, Nombalok. So I'm not going to spend a lot of time on this because I think those of you joining this talk today, I'm guessing, are already convinced that menstruation is incredibly important and matters for millions and millions of people around the world, and that it's a topic that has not received enough recognition or attention, but that is incredibly important in achieving our sustainable development goals and human rights, and providing health and well-being for people around the world. When I say menstrual health, what I mean by that is an individual experiencing a state of complete physical, mental, and social well-being in relation to the menstrual cycle. And so it's really a holistic term that we did some work defining in 2021, capturing a whole range of experiences. And in order to experience menstrual health, we know that people around the world need a consistent set of needs to be met. So for menstrual health, we need access to accurate, timely, and age-appropriate information. We need access to supportive materials, facilities, and services to be able to care for the body in ways that work for us. We need access to diagnosis, treatment, and care for discomforts and disorders associated with the menstrual cycle. And we need a positive and respectful environment, one that's free from stigma, free from distress that often surrounds menstruation, as well as the freedom to participate and choose participation in spheres of life throughout different phases of the menstrual cycle. What all of this means is that when we're trying to deliver menstrual health in policies or in interventions and understand how we're doing at supporting menstrual health for women, girls, and people who menstruate, is that there's a lot of different complex needs that are interrelated that we need to be thinking about. We also know that around the world, these needs are often not being met. So I'm not going to unpack this diagram in detail, and I don't know how big it is on your various screens, But this comes from a systematic review and synthesis that we did a couple of years ago of 76 qualitative studies, so studies that collect participant stories through interviews and focus groups that were undertaken with women and girls in low and middle income country contexts. And what we found in this review was similar to what's articulated in the definition, which is that there's a really wide variety of needs and challenges that people face when they're experiencing menstruation, and that a lot of people around the world are struggling to meet these needs, that they're not having a positive experience during their menstruation and not experiencing menstrual health. What we found is that this, consistent set of challenges is presenting difficulties for menstruation, and that this is described as going on to cause significant consequences for health, for well-being, for engagement in society. Through a variety of different pathways. So what's really fantastic about qualitative research is that it helps unpack all of the complexity that is relevant when we're thinking about all the different things somebody experiences during their period, and all the different challenges that might face, how that might make them feel, what that means for their experience, and that there are then all different parts of those challenges that go on to have these impacts for broader social participation, education and employment, psychological health, and physical health. So this body of qualitative research has been really important in drawing attention to menstrual health across context and spurring policy and practice initiatives. But one of the significant challenges that we have for the current evidence base around menstrual health in low and middle income country contexts, but I think in also many areas of research around menstruation in high income countries as well, is that most of the research to date has been qualitative. And we don't have strong quantitative or numeric estimates of the impact that menstrual health or menstruation is having on people's health and well-being. And this has really significant implications when we are wanting to mobilize large-scale financial investments to improve menstrual health. Large donors, governments, they want to know, what is this costing us? What is this costing us economically? What is it costing in terms of health and well-being and education, and these sort of established agenda items that we have or that have been set out as goals? What is the impact that menstruation or menstrual health is contributing to these outcomes? And at the moment, we don't have good data, we don't have good estimates to answer that question. And so this was really the primary motivation, although there's a lot of other things that we want to understand in our Adolescent Menstrual Experiences and Health Cohort Study, or AMEHC, which we call it for short. So this really motivated us to say, well, how are we going to unpack all of this complexity, all of these different menstrual health needs that are contributing to a range of outcomes? And we know women and girls are telling us that this is the impact that it's having on their lives. How can we demonstrate these effects? How can we test them and test the different pathways through which various menstrual health needs are impacting on their lives? So with AMEHC, we have 3 broad objectives. The first one is more basic. It's really to understand how adolescent girls' experiences of menstruation are changing over time. A lot of the qualitative and existing research that we have has either asked about girls' experiences at menarche or at a single point in time. But we anticipate that as girls grow up through adolescence, as they get more experience with menstruation, as they get older, as they get more social resources, that their experience of navigating menstruation and the needs that they have around it are likely to change. We also don't know if there are different trajectories that girls experience. So those perhaps that do really grow in their strength and get more positive experiences over time, girls that experience disruptions or continue to struggle or that take on new menstrual health challenges as they move through adolescence. And so the first goal of our cohort study is really just to understand what these changes look like when we follow a group of adolescent girls over time. Our second objective is the one that as I say, really motivated doing the study in the first place, which is to understand how, this repeated difficult or not experience of menstrual health goes on to impact girls' health and education over time. And thirdly, we wanted to really invest in testing quantitatively many of the pathways that have been highlighted through qualitative research. As I say, we've got this great body of qualitative research that's talked about the different difficulties that people have, how that makes them feel, what they experience, and how that goes on to impact their lives. But we don't have, again, quantitative research that has tested these pathways and that looks at how maybe some of these different needs might impact differently on the outcomes that people describe. So to do this, we are undertaking a longitudinal cohort study. This is a study where we recruit a group of girls at the same point in their lives, and we follow that same group over time. By following them over time, we're better able to understand how their needs change. Whereas if we were just to look at girls at different ages, we wouldn't really know if those experiences were changing due to age or other variations when we've got a sort of broader sample of ages in a study. The longitudinal study is also important because most of the hypotheses that we have about the ways in which menstruation impacts on health and social outcomes is because of a repeated difficult experience. I don't think we're ever out there saying that it's one bad negative period that goes on to mean significant consequences for girls' education or their well-being. It's really that we think that having this negative, difficult experience every month and that continues over time is sort of aggregating and building to contributing to these more substantial outcomes that we want to quantify and convince governments and donors to invest in over time. Another reason, so in a longitudinal study, because we're then measuring multiple points in time, we're understanding how things are changing, we're able to get a better picture of that sort of sustained or cumulative effect of difficulties with menstrual health. Another reason that we wanted to do a longitudinal study is that we do have a number of hypotheses or expectations that early experiences of menstruation might be influential for outcomes much later in life. So there are a few longitudinal studies that have captured things like early timing of menarche and looked at, sexual and reproductive health or mental health consequences many, many years later. So in this study, we're wanting to look at those effects as well, but to ask questions that we haven't asked before about how the actual experience at menarche might contribute to those effects. By following the same group of girls over time, we measure what's called prospectively. So that means that we capture girls' experiences as they're happening right now. So when we ask girls at our baseline about menarche, they've just experienced it, and we're asking them to tell us about that experience. Then we're asking them to tell us about the experience that they're having now in class number 7. Then we're asking them to tell us about the experience they're having in class 8. Because we're measuring things as they're happening, we're getting more accurate measurements that aren't being perhaps impacted by needing to recall things far in the past or that might be influenced by later experiences. It also allows us to make much stronger claims about the impact of early experiences on later outcomes because we've measured them in the order in which we hypothesize that they're happening. And finally, we felt that a longitudinal study was really important to help inform intervention trials. This is another type of quantitative research study that we absolutely need more of in menstrual health research. Trials that test the effectiveness of different interventions that might be effective in supporting menstrual health and improving these other outcomes. But something that we felt was that, there's only been a few of these trials, and a lot of them have measured the effects of interventions on very different outcomes. And I think that in menstrual health research, we've not always been clear about the pathways from particular interventions that address some of the very different menstrual health needs and the impacts that they have on very downstream consequences for girls' lives. So I worry that in some cases we're testing the wrong intervention for the wrong outcome, and perhaps doing ourselves a disservice because we've not totally linked up those pathways. So part of what we want to do, and part of that third objective of our study, is to look at the pathways from these different menstrual health needs and look at what contributes more substantially to outcomes that we're interested in, to then help inform perhaps what some of the primary outcomes should be in trials that are then implementing interventions which address different menstrual health needs. So next I'm going to talk through the studies and the design of our AMEHC work, but I thought to give you a primer and a break from listening to my voice, I'd share this introductory video. This is an English version of a video that we shared with participants as part of our recruitment for the study to explain it to them and to invite their participation. And do let me know if you can't hear it, but we did test it just before.
Welcome to the Adolescent Menstrual Experiences and Health Cohort AMEHC study. This study is being run by researchers at the Burnet Institute in Australia and the James P. Grant School of Public Health, Brack University, together with Water Aid Bangladesh and their partner Novolo. This video will explain why we are doing this study and provide you with the information you need to decide if you would like to participate, including what's involved and risks and benefits. We are doing this study because menstruation matters. Menstruation can be challenging for girls, but it's a normal part of life. Girls need to know about their bodies and how to manage menstruation. We also expect menstruation needs will change as girls gain more experience having periods moving through adolescence. This study will collect information from 2,000 girls in the Khulna district. Once a year, we will ask girls what they know about their bodies, periods, and how they manage their periods. We want to understand how periods impact life, so our survey will also ask about girls' physical and mental health and how they feel about themselves. Some girls may be asked to be part of additional smaller studies. For example, in the first year, we will survey 400 of the 2,000 girls 3 more times. But these surveys will be short and won't impact schooling. We also want to ask the girls' guardians about their households and their ideas about menstruation through a short survey. Finally, we will ask participating schools to share some information about the menstruation facilities that they have and some information about participating girls' schooling. All the information we collect will be kept securely and anonymously. By participating, you will be helping us better understand how girls experience menstruation, how it impacts their lives, their physical and mental health, and schooling as they grow up. So we can follow the girls to survey them each year. We will collect some contact details. But don't worry, this information will be kept securely and in a different place from the survey responses. It will only be linked to the survey through an anonymous code. We know that talking about menstruation can sometimes be embarrassing, but we don't expect the survey to cause discomfort. Girls don't have to answer the questions that make them feel uncomfortable. No one has to participate in the study. Participants will be asked to consent and will have the opportunity to ask any questions they might have. Girls who participate will receive refreshments and a small hygiene kit. We will share the results of the study with participating schools, government, NGOs, and researchers to help deliver better support and programs for girls. We hope you agree to join us in this study.
Great. So as you hopefully heard in the video, the core part of what we're doing in the AMEHC study is following a cohort of 2,000 girls over multiple years, which is the sort of middle part of our graphic here. Alongside that, periodically, we are surveying their parents to collect information about household level data and parents' support and attitudes towards menstruation to look at those effects. We have a total of 101 schools that are a part of the study, and each of them participates in a yearly WASH observation checklist. So looking at the quality of water, sanitation and hygiene infrastructure in the schools, as well as the education that they're providing around menstruation, and some of the other features of the school that might be important for girls' experience of menstruation. We're also collecting from schools, girls' attendance and performance data. So next I want to talk through a number of the different pieces of this study and the things that we've been doing to establish this program of work. So firstly, prior to starting the cohort, which enrolled our baseline in 2023, we set up a national advisory committee, which was stood up in 2022. Our national advisory committee provides feedback on our study approach, reflections on aligning things included in our study with national policy objectives. Bangladesh is a real leader in trying to direct policy attention towards menstruation and has some national strategy and objectives around menstrual health among adolescent girls. So we're paying a lot of attention to policy changes and any implementation changes that are happening to make sure that we can capture them as part of the study that we're doing. Our advisory group also provides, as we have findings, feedback on their interpretation and the implications that they have for practice. This group meets twice a year and receives written updates about our progress. Alongside our National Advisory Committee and prior to the cohort, we undertook workshops with communities in our study area, which, as you saw on the map in the video, is the Khulna district of Bangladesh. We're working in 2 sub-district areas, an urban setting and a rural setting. And so we undertook workshops in these locations to inform community leaders, education officials, teachers, head teachers and principals and students about the study and to hear back their views around menstruation and about the work that we wanted to do. These workshops, as you will see in the timeline again, are being undertaken yearly. So in the first instance, these were really about providing information about the studies to communities and hearing their feedback back on what we were doing. As we progress through the study, there will be more about sharing findings and then hearing community reflections on what we found. Prior to the study, so throughout 2022, we undertook a whole series of preliminary research activities before starting and enrolling the cohort that were really about understanding in depth the menstrual health situation in Khulna in Bangladesh and testing out the survey measures and tools that we wanted to use as part of the cohort. So the first one of these activities that we did in 2022 was a series of qualitative activities. So we undertook a sort of stage set of focus group discussions with girls and with mothers, and individual interviews with girls, mothers, fathers, teachers, and focus group discussions with boys. There has been, a lot of fantastic formative research in Bangladesh already around understanding menstrual health challenges sort of broadly. So our qualitative research was really focused at making sure we understood some of those issues in Khulna specifically and where there might be any variation for the group that we were looking at. But more of their focus was on diving a bit more deeply into some specific areas where we felt like there wasn't enough clarity to inform what we wanted to measure, or where we really needed to understand more about what was going on to inform the cohort. So one of these areas was about investigating more around girls' menstrual health literacy. So this isn't just what girls do or don't know about menstruation, but also their capabilities in accessing information, how they interpret and navigate conflicting information, and how they critically apply information in their own lives and understand applying that information within their own body. We wanted to understand and be able to unpack both the knowledge questions that we needed to be able to ask as part of the cohort, but also understand more about, as girls were moving through different ages in high school, which was the target for the cohort, how they were conceptualizing this knowledge and applying it, because those were things that we also wanted to capture in our study, not just what girls did or didn't know. The second objective for the qualitative work was a really phased investigation to identify specific social norms that were relevant to influencing girls' experience of menstruation. I could talk about this for a whole 45 minutes as well, but this meant a process where we went through a series of different activities and focus groups, and then in individual interviews with girls, as well as sort of daily revision as a team, as we were hearing back through the activities we were doing from girls, to really understand what social expectations were being placed on girls, whether or not they believed other people were expecting them to adhere to these behaviors, and what the sanctions were. So what were the ways in which some of these restrictions around menstruation or difficulties were being reinforced, either through positive praise or through punishments. We looked at this across a number of different candidate norms or behaviors that were being impacted by norms. And so wanting to understand things like whether or not there was a norm that girls were expected to keep their menstrual materials hidden at all times, whether they felt that was something that all girls were doing and all women were doing across the area, how they understood that that was something that they were expected to do, and what punishments or rewards were in place that kept that norm going by continually reinforcing it. Similarly, we investigated some behaviors around the use of pain medication or seeking care for pain, as well as sort of girls' engagement or ability to come to school based on parental expectations. Ultimately, this program of work helped us narrow down some core norms that we wanted to be able to measure in quantitative tools as part of the cohort. After our qualitative work, we undertook cognitive interviews. So these are interviews where we sit down with girls and we go through a series of the questions that we want to use as part of our survey, but we ask them to explain more about their answer or how they understood the question or the different words that we use in the questions to try and assess how well our questions are working. So understanding if girls are getting the same message out of them as we are intending and how they're answering. So I've got one example on the slide here of a question that we use as part of a scale looking at how girls experience managing their menstrual bleeding. Were you worried that your menstrual materials were going to let blood leak onto your outer garments? And here we have different cognitive interviews with girls who are giving different answers. This question has 4 response options: never, some of the time, most of the time, and always. And we have girls who are saying, no, I'm never worried about this. My bleeding's not that heavy. I'm wearing a pad properly. I'm not worried. Compared to other girls who are saying, yes, most of the time I'm often tensed about this, or I'm constantly worried because I've got heavy bleeding. What this tells us is that there's a variety of reasons why girls might be answering these questions in different ways, but it also communicates that girls have understood what we're asking here. Are you worried that you're going to leak onto your outer garments? Yes, girls are understanding this question in the way that we intended, and they're giving answers that reflect their experience. Finally, after undertaking cognitive interviews around a series of different sets of questions that we wanted to use as part of the cohort, we undertook a pilot survey. So we had a sample of 360 adolescent girls that spanned a few different grade levels in Khulna, again, to help us test out and get a picture of what was going on in the setting, and to use some other statistical techniques to sort of validate using a number of different approaches, the measures that we were going to use as part of the cohort. To give you a bit of a sense of the circumstances for the girls in our sort of area in Khulna, we found that almost 60% of girls in the pilot survey didn't know anything about menstruation before they had their first period, and half of them feel like they don't have enough information about reducing pain. We found that almost half of the girls were never happy with the facilities available at their school for changing menstrual absorbents, and that most of the girls were unwilling to change at school. They either left early or waited until they went home to change their menstrual absorbents. Half of girls reported leaking during their last period. More than half, 60%, had reported that they always had enough materials. That could be pads or cloth. There was varied use across our sample for their period. 1 in 5 had been teased in the past 3 months about menstruation, and almost half self-reported experiencing difficulties participating in class because of their period. So this, I think, is more illustrative, and for those who are perhaps less familiar with some of the challenges that we're looking at unpacking as part of this study in this setting. But this also, for us, helped to reinforce that our population is definitely having a lot of different menstrual health challenges. We also found, as part of the pilot survey, that our measures were performing reasonably well. It helped us to make appropriate changes. And we found that we were having suitable variability in the girls across the different challenges, some who are having much more difficulty, some much less. That's going to allow us to, as part of the cohort, sort of explore what those different experiences mean for girls' outcomes over time. So with all of this preparation done, that takes us through to the main cohort, which started at the start of 2023. We recruited the cohort using a sort of systematic approach. So the pilot survey was more a convenience sample of schools that we'd sort of purposefully selected for some variability across the region. And we looked at a number of grade levels. For the cohort, we wanted all of our 2,000 girls to all be enrolled at the start of class 6, which is the first year of secondary school. We systematically listed all of the schools within the district to collect a representative sample of girls across urban, and rural areas of Khulna. As I said, we had 101 schools that were participating in the study, and we also surveyed 2,000 guardians, so usually a parent of one of the girls, alongside consenting them to get information about household demographics and parents' perspectives. We also collected a lot of contact information to help us find the girls as we move through the cohort over time. And we included schools of a number of different school types, so co-educational, single-sex, and madrasa, so religious education system schools, as part of the cohort. Our next full cohort will be in April 2024, so that's the next time we'll follow up all 2,000 girls again. Although, as I'll mention, we did do a sub-cohort study this year where we followed girls a lot more intensively over the year. As we move through the cohort and as we keep following up our same group of girls over time, I should say in class 6, they're all around 12 years old, starting secondary school. As they progress through school, as they age and continue in having their periods, we will be looking at measuring all the different aspects of their menstrual experience, which is a bit much to talk through in a presentation. But we'll also be looking at a whole series of outcomes that we think are really important, or key outcomes that we think are really important to understand the impact that different menstrual health experiences are having. So, for example, in thinking about education, we're thinking about this as our sort of broad outcome, but as we move through the cohort over time, we're going to be measuring this at different levels, following the sort of pathway that we hypothesize menstruation or menstrual health is impacting on girls' education. So in the first instance, we'll be looking at girls' attendance using school attendance registers and their self-reported participation in school, hypothesizing that girls' difficulties managing their menstrual bleeding, managing pain at school, experiences of shame or teasing related to menstruation, and parental restrictions around attending school during menstruation might all contribute to girls either missing parts of the school day or full days of school, which we'll capture through the attendance registers, or girls withdrawing from participation in class, which we're collecting through self-report. And that's the first, educational outcome of which we might be testing. Well, one is to evaluate the relationships between those different menstrual health challenges and this outcome. We would then hypothesize that regular absences and disengagement related to menstruation might then impact on how well girls are ultimately able to perform as they move through their schooling, and their willingness and family support to then keep moving through each grade level, and ultimately the time to which they drop out of school and the level of education in which they achieve. So as we follow girls through over time, we'll be able to look at these sort of building outcomes, which become sort of more harder and harder outcomes that have increasing sort of interest from government and donor perspectives. Similar when we're thinking about sexual and reproductive health, we've done a lot of work over the first 2 years of the study to set a priori, so in advance, statistical analysis plans and hypotheses about the different menstrual health needs that we expect to be impacting on these outcomes, and again, the trajectory or pathway of outcomes that we're interested in. So sexual and reproductive health outcomes are something that we might anticipate that menstruation or menstrual health has an impact on over a very long period of time. And in looking at these, we've charted these out, again, saying, well, in the first instance, we hypothesize that difficulties with menstruation, perhaps distressing experiences at menarche, might impact on the way that girls view their own bodies, their body image, their relationship that they have to their bodies. It might also impact how much they communicate or seek information and support about reproductive health topics. We then think that this outcome is the first step on the pathway to then perhaps not accessing sexual and reproductive health care, or longer term outcomes like contraceptive uptake or early pregnancy. And we have similar pathways that we're looking at across our different outcomes that we're looking at as part of the cohort. And so finally, as I mentioned, throughout 2023, we've been following a subset of 400 girls, all of whom were menstruating at baseline, to look more intensively about how menstrual experiences change over a short period of time. So we wanted to look at, are girls changing the materials that they're using? Are they changing their experience and confidence in managing menstruation throughout the first year of high school? As well as that this will give us some early experience in looking at these sort of sustained exposure variables that we want to look at as part of the study, and the impact that this might have had over a full year on girls' mental health and their urogenital symptoms. So there's, I guess, probably a huge amount of information about a whole lot of things that we're trying to do in this study, but thanks for listening to my sort of flying tour through all of the work that we're doing as part of AMEHC. And I certainly look forward to coming back once we have more waves of data collection and sharing what we're finding through this work, and really happy to answer, questions about the study or menstrual health.
That's perfect. Thanks so much, Julie. Yeah, so interesting and so inspiring. But this must have just been so much work, and really, really great to see that it's happening. Yeah, any questions? Let me give people the permission. But also, yeah, feel free to put them in the chat or put your hand up. I mean, whilst people are thinking of questions, I have one, I guess. This is so awesome. Have you got plans to kind of run it in other locations or a similar kind of study in other locations? And I guess I'm specifically thinking about like then having like comparisons. So in different contexts, and what would the differences be to the study design that would have to happen for that to be worthwhile?
Yeah, I mean, it's been a huge amount of work to set up in one context, as you've heard, but I think over the long term, those same effects in different contexts is absolutely the evidence that we need. I think some of the preliminary work that we've done around measurement and contextualizing the measures that we're using, pre-specifying hypotheses, so the relationships that we specifically want to test as part of the study are things that we need to look at again in a new context, as well as the big hurdle of getting a whole nother cohort funded. But yes, I think long term that would be fantastic. As well as I think there's need for this in high income countries where we have cohorts, but a lot of them have looked at more biomedical or clinical parts of menstrual experience and not some of these other transitions in terms of knowledge, bodily autonomy, even period poverty or difficulties with menstrual management.
Mm-hmm. Yeah. Totally appreciate it's a huge amount of work to get this going. I was just thinking, it would be so cool to have this like in various different places and be able to see the kind of cross context comparisons. Sorry, were you going to say something else? Did I interrupt you?
Oh, I was just going to say, do you want to take the question? I see there's a question in the chat.
Yeah.
Hands raised. Do you want to? I'll let you.
Okay, yeah. So Sally just also praising the sort of comprehensive nature of the study, but her only question is around reaching the most vulnerable. The requirement to speak to parents or schools might put some girls off.
Yeah. So I mean, our inclusion criteria for enrollment into the cohort is that girls were enrolled in and then we were able to find them that they were attending class 6. So girls that have dropped out of school before transitioning to secondary school are not going to be represented in the cohort. That was a decision that we made where we think the proportion of girls at that age who would be menstruating is going to be quite low and the cost of finding them is very high. We also wanted to have a sufficient sample to look at education outcomes over time. We know that girls are going to be dropping out of school, and part of our protocol is that we'll be still following those girls over time to look at all of their other outcomes. But we still did need that starting point, and that does mean that girls who are not in school, we did include questions in our cohort demographics about disability, but I'm sure we're underrepresenting those experiences given that those girls are probably less likely to be in schools. Getting parental consent for 12-year-olds to enroll in a cohort is unavoidable. So yes, it means that parents who are less available or that we couldn't track down meant that girls weren't able to participate. I will say the team did an incredible job of really tracking down all of the girls that we could possibly find from the school listings, many of which were there was many more girls enrolled than we could find, but we anticipated that. But yes, I think that will always be a challenge when we're trying to access girls, but also there's a need from a cohort perspective to say, well, this is the population that we need to enroll at the start and that we're going to be able to look at.
Mm-hmm. Great, thank you. Adrian.
Yeah, thank you very much for the presentation, Julie. It's great to see how far you've progressed with the study already. And I may have missed this part, but it'd be great if you could briefly speak towards what parts of the study are fully funded and what parts you're still looking to fund, and how people in the room can help with that.
A fantastic question, Adrian. What a fantastic question. Yes, I think Adrian also knows that getting this piece of work funded was incredibly difficult and that we have Frankensteined like 4 different grants together to be able to get it off the ground in the first place. We do also want to be able to follow girls for much longer than we currently have funding for, so that we are able to look at those longer term outcomes. As well as that, I think there's some, additions and support in terms of making sure that we're able to incorporate everything in the study that we want to. So we continue to have funding needs over time and are very open to collaboration and efforts to keep that happening, as well as support for, as you mentioned before, setting up other sites in other locations for evidence that we need for other settings.
Great, thank you. Tigist?
Thanks, Gemma. Thank you, Julie. That was a brilliant talk and a fantastic team of people you've got, and seeing their water rate, for example, is really great, because the WASH is one of the key areas in this context, and I hope you'll be able to talk about that at some point if you have, if your research incorporates that. It'd be great to know about that. I'm interested in the myth around the knowledge around menstrual health and SRHR. In my own work, their understanding about missed period, for example, was quite fascinating, in terms of if you miss your period, you can take 40 ampicillins with Coca-Cola and everything will be okay. And in your work, I could see don't eat fish when you're menstruating and that kind of stuff. So it'd be good to know if you can tell us a little bit about the knowledge and education about sexual health, as well as menstrual health. Thank you.
Yeah, thanks. I mean, we are really grateful to have, I should say as well, the funders that we have, so NHMRC, the Reckitt Global Hygiene Institute, who have stepped up to fund this study. We're incredibly grateful to. And it is fantastic. We have WaterAid and Novolok in Bangladesh, who are NGO partners in the study. And their role is really around facilitating community engagement, providing expertise on that WASH component, and looking at translation of the findings into practice. Whereas our incredible team at the James P. Grant School of Public Health, BRAC University, are academic, co-conspirators and partners in this, in doing the research parts of this. So it's nice that we have from the start been able to build in a sort of research and practice partnership. The school audits, yes, there's lots more information available about the checklist that we're using, the WASH sort of observations that we're doing. And we did also have parent reported household WASH information. So we will have that for girls reported by the parents, to understand what their household sanitation and WASH is like. In terms of knowledge, yes, it was very poor. In the pilot, we actually found we had tested out questions around fertility in the fertile window, and we ended up taking them out of the cohort baseline, because until girls were 15, 16, even the preliminary questions of explaining, is there a time when a woman's more likely to get pregnant, just wasn't working. And I think we did also ask some of those knowledge questions to parents, and things like some of the standard indicators of knowledge of the fertile window were quite low. I think there are different myths and taboos in every context or things people are navigating. Fish was one, in this setting, although at the same time, I think there'd been nutritional focus. I feel like some of the information that girls had gotten was a real pressure to have good nutrition during menstruation. And I think there'd been some other efforts within the district to really push nutritional messages. So there was a bit of a conflict there between, fish will make your menstruation smell, but nutrition during menstruation is really, really important. So unpacking that, complexity was really interesting. And we found really different views and knowledge around things like pain relief. Like some groups who were thinking no way, and other people were like, yeah, well, you can go to a pharmacy and ask and see what they'll give you for menstrual pain relief. So there was also a real variety of views and levels of knowledge.
Thank you. I don't want to take too much time, but it'd be good to see also the quality of education they were getting, depending on the school, the nature of the school. but I don't want to take time anymore, but I'm sure I'll be in touch.
Thanks, Tigges. Nahid?
Thank you, Dr. Julie, for your nice presentation. I have only a simple question about why you chose the Khulna region in Bangladesh. Is there any specific reason that you choose? And one more question for the education you will read to the students, the school girls. Is it incorporated with the national curriculum of Bangladesh education ministry, or you not incorporate or planning? What's your plan?
Yeah, so to your first question about Khulna, that was a decision that we made in collaboration with the James P. Grant School and with WaterAid, and it was a mix of setting a criteria. We wanted somewhere where WaterAid had strong relationships with the community and district education officers, but somewhere that they were not implementing a menstrual health or large-scale menstrual health intervention at the moment, but may do so within the next 5 years. So we had that criteria in an idea that, well, we don't want, if we can avoid it right now, disruptive big programs that they might otherwise be running to be in the study area, but we want the capacity to be able to inform interventions that could then be delivered over the next while. It was also a sort of, we wanted somewhere that had rural urban populations, that was affordable in terms of feasibility and travel for the research team, as well as that stakeholders in the National Advisory Committee felt that climate vulnerable regions, which Khulna is, inclusive of climate vulnerable communities who are experiencing upheavals in WASH, was an important community to capture. So all of those things worked together, and it was a sort of joint strategic decision to select Khulna. In terms of education, so we are not changing anything that the girls are receiving. We will hopefully do our best to monitor the extent to which the national curriculum is being delivered. And obviously we are looking at all girls who will progress through secondary school at the same time. I think, as we know from menstrual health research, teachers are not always comfortable delivering curriculum, and I think it will be interesting to hear as we go through from teachers the extent to which that's being delivered, or their comfort with delivering that content.
So thank you and best wishes for your rest of the research.
Thanks.
So some questions from the chat, which I think two of them are kind of related. So someone was wondering what the different validated tools or surveys or questionnaires are used for the outcomes, particularly social participation and anxiety and depression. And would you recommend using those same tools increasingly in studies? And I felt that was kind of related to another question. What specific quantitative data will you collect in an upcoming cohort study?
Yeah. So I didn't feel like it would be necessarily friendly to a big broad audience to spend a lot of time talking about measures, although anyone who has had the possible displeasure of having to talk to me about this topic before knows that measurement of menstrual health constructs is something that I am very passionate about and spend a lot of time thinking and talking about. So in terms of our menstrual health exposures, we're using a number of measures that have been developed recently, things like the menstrual practice needs scale to capture experiences of blood management. We have some measures that we developed specifically through the pilot work, adapting measures of shame. Body appreciation scale, we took an existing BAS measurement of body image that had been used in high income populations, and so did quite a bit of work to translate it and see what would work in our Bangladesh context. We used things like the short list of recommended indicators for national monitoring of menstrual health and hygiene, and we are measuring all of those indicators as part of the study. For those who are interested, UNICEF put together a great guide to measurement and menstrual health research and practice, and so some of our knowledge questions are taken from there. We have a protocol paper that is under review that will share the full survey questionnaires and tools, so they will be available very soon. We will also have a website that explains in more detail the different exposure measures that we are using and why, but it will be launching in 2024 because, as you've heard, our team has had a lot to do. In terms of the outcomes, social participation is we're using the measure that's consistent with the short list of recommended indicators and the same question that's being used in the JMP mix surveys. So it is comparable to that national level data around participation in school during or due to menstruation. For anxiety and depression, in our pilot survey, we actually tested 2 different tools. We tested the DAS-21, the Depression and Anxiety Stress Scale, and we tested a combined measure that used the PHQ-9, which is a measure of depression, and the GAD-7, which is a measure of anxiety. Both of those tools had been used and had translations in Bangladesh. We found that the DAS-21 worked better in our sample. The questions were better understood by girls, and it sort of had a better yield and variability. We were more confident in the results. So in our pilot, we had halves of the sample do the different mental health measures. And so from that work, which we will publish on soon, we selected the DAS-21, and so we're using a Bangla. It's the Bangla translation of the DAS-21 youth version, which is a standardized measurement tool for mental health. I think there are other measures that have been used to measure mental health in menstrual health studies. This was our process. We really wanted something that captured specifically depression and anxiety. I know the strengths and difficulties questionnaire is the other tool that had been used in menstrual health research. We did decide not to use that because we felt that it wasn't as aligned with assessing depression and anxiety, which we felt were the most relevant to difficulties with menstruation.
That's great, thank you. Thanks. Yeah, I was just thinking then, it's so like such a lovely study. Like, it's so nice to hear like all this careful thought that's gone behind each of the measures, and I think it really nicely highlights the value of mixed methods research and being able to work out, you know, not just, oh, we'll choose PHQ-9 because that's used like so often, but we'll actually work out whether people are understanding what those questions are and whether that works in this population. It's great. There are a few more questions actually, but I'm going to go to Kate's question around, because I'm also very interested in this. Could you talk around the number of people needed in your team to execute this kind of research over the long period that you're talking about?
More than we currently have. But we're working on that. I mean, we had an incredible field team of 24 field research assistants, plus a team of 8 coordinating staff for the baseline, as well as community representatives from Nobalok, and a junior statistician, and team who were working on some of the ODK and the data stuff. So a big field team. And then I think I had on the slide the names of we've got people in our team in Burnett and at JPG BRAC and other collaborators who are working with us. But in terms of the field team, it was, you know, I'm saying 24, but I feel like it could have been 28 field research assistants who are administering the survey, but they had 6 days of training, and then we had a whole set of trainers and field administrators who were supporting them.
Awesome, great, thank you. I think we'll leave it there because we're over time. But thanks so much, Julie. That's so interesting and really great work. Yeah, really look forward to seeing what comes out of it. There was just one question actually in the chat around the hypothesized causal change pathways between menstrual health needs and outcomes, which I think you've outlined really nicely in a couple of papers, which we'll put on our 4M website so that people can see that. after
Yeah, I'll add, we did spend a lot of time drawing out some really still ugly looking DAGs that outline a priori our hypothesized pathways in the study. They are in the protocol paper, which I am hoping will be out very early 2024. So we do have some diagrams for them. They're just, you know, maybe we need some more graphic design budget for our study, but you know, there's a lot of different pathways that they get a little bit messy to talk about in a presentation, but I am really happy to share them, and we are looking to publish them as part of the protocol.
Perfect, great. Okay, thanks very much. Thanks, Julie, and thanks very much to everyone for coming. And yeah, we don't have another one planned. We might have another one, but we're not sure yet. So I'll see you when I see you, I guess, to everyone in forum. But yeah, thanks very much. Cheers. Bye.